everyone. And first off, thank you all for being here. And a huge thank you to Mayor Turner, Director Williams. They came out to support me as I get the COVID vaccine. I'm 8 months pregnant, and I know a lot of pregnant women are out there right now that are nervous about getting this. And we always encourage you to talk to your provider. But because the risk is so high for pregnant women with COVID, you're more likely to end up in ICU and on life support. There's studies coming out that may indicate preterm labor. This vaccine is safe, and we encourage you to get it with the guidance and instruction of your medical provider. There's a lot that goes into the safety protocol of this, which is why I felt so safe coming out here to get the vaccine through our city's health department. For example, there's one thing, and you go through a lot of different procedures and protocols when you're pregnant. You get a lot of different vaccines, and one of the requirements with this is that you cannot have had any other vaccination, including the Tdap vaccine, when in between 2 weeks from when you get that vaccine to the COVID vaccine. And unfortunately, I was not aware of that, so I'm actually not going to be getting the vaccine today. I'll get it 1 week from today. But it's the diligence of our health staff and our community that are taking so many precautions right now to make sure that this vaccine is safe for me, safe for my family, and safe for our community. So while it's there's a bump in the road with the vaccine, for me getting it today, I cannot tell you how excited I am to get this, and I'm going to hand it off to Mayor Turner because I know he has a lot of other information regarding the vaccine and the great work that our health department under the guidance of Director Williams is doing, including you, our chief medical officer at this community facility, and all of our healthcare workers that are heroes right now.
And before I speak, I want to bring up one of our healthcare people to explain how the process works and the checklist and how it works. And it is working, and it worked in this case.
It did.
So, because you have to fill out the paperwork, and then they walk you through various things. So if you would explain how it works.
So when you come in, we'll give you a packet which is like this, and it will go over your demographic information, your rights and responsibilities. It's about a 16-page packet. On the second form, it is considered a pre-checklist. On that pre-checklist, it will go over if you've had the vaccine before, if you've had any vaccine before. And just like she said, if you've had any vaccine within the past 14 days, you have to wait until that time period to get your second vaccine. Also, we have to make sure if any medications, any allergies. So before you get your vaccine, we check this twice before you come in. So she is more than welcome to come back next week, and we will gladly give her vaccine because we have them to give. And she's a community that we really want to serve, but we just had to make sure that she was safe. And her baby was safe.
Dr. Williams?
First, I want to thank the council member for her willingness to share her personal experience. But also, thank you to my staff, because it's the diligence of the staff that actually followed the protocol to ensure that we were in the guidelines as laid out by CDC. We're in Nueva, Casa de Amigos. This is one of our 4 health centers that are actually providing COVID vaccine to our community. One of the things that we want to really emphasize is that the qualifying population is those individuals that are 65 and older, those individuals that are 16 and older that have chronic conditions. And in some instances, it's very difficult for folks to make it to some of what we call our mega sites. And so, therefore, we want to make sure that this vaccine is accessible to everybody. We're here in the near north side, which is one of the first communities I actually was on the ground and interacted with almost 16 and a half years ago. And so I'm really grateful that we're able to do this. As vaccine becomes more available, we will make sure that we have more community locations like this to ensure accessibility for people that have transportation and other issues that might preclude them from going to one of our centralized sites.
Thank you. And let me just say, I want to thank Councilmember Abbie Kamin for allowing us to walk with her through this journey. And as she indicated, 8 months pregnant. We know that there's a lot of apprehension, reservations by people, and especially pregnant women. And so I appreciate the fact that she's allowing us to walk with her publicly every step of the way. And this is one of those, this is an important step here. Making herself available, coming, going through the checklist, and in this case discovering had a vaccine within the last 2 weeks, and now having to wait another week to come back. And I'm glad that we're sharing that, because we want people to know we're taking every precaution to make sure that you are kept safe. We're not taking any shortcuts with anyone. Okay, with anyone. You have to fill out those forms for a reason. And then as they walk you through those forms, and they are going through those forms with you, we're making sure that we're following all the medical protocols. So, Councilmember Kamin, thank you so very much. We'll be back again. And look, and good or bad, I was going to be giving her shot today. So, but I'll be back to be with her on this journey. I will say that the mega site at Minute Maid will be open. Let me confirm that. We'll still go through the pre-registration. We'll go through the pre-registration, but that site will be open. We've also provided doses of vaccines to some other sites as well. And so the goal is to ramp up. But we were able to do a little under 4,000 on Saturday. Our goal is to do just as many, if not more. And then the way we'll work, we'll advance the list of people who have already enrolled, and then we'll back in bring other people forward on the registration. So make sure that you're following up on the HoustonEmergency.org/COVID-19 or make the online calls. But the goal is to get these vaccines out as soon as we get them, because we don't want them on the shelf.